We've now come to the sponsor perspective portion of our program. Please welcome to the stage Caroline Fisher O'Neill, Director of Alliance Development, Government Affairs, and Public Policy at Otsuka America Pharmaceutical, and Griselda Butler, Director of Independent Medical Education and External Relations with Otsuka Pharmaceutical Development and Commercialization.
Good morning everyone. It's a pleasure to be here with you today. It's a pleasure to be here during the Bebe Moore Campbell National Minority Mental Health Awareness Month. And it's really an honor to be a part of this conversation around mental health inequities as experienced among minority populations here in the United States. We feel that it's a privilege to sponsor these types of conversations and bring research such as Daniel Dawes just reviewed for you to the forefront. Otsuka is a global leader in the challenging field of mental health, treatment for mental health, mental illness, as well as brain disease, and is dedicated to bringing new treatments and programs to affect positive change for better health worldwide. We have a deep respect for the value of every mind and feel very strongly that effective treatment for mental health is what we need to be focused on with the same sense of urgency and priority as other chronic conditions. So I'm joined this morning by my colleague, Griselda Butler. Good morning, Griselda.
Good morning, Caroline.
Griselda is also a co-lead for our B1 Employee Resource Group. B1 stands for the Black Employee Otsuka Network for Engagement. And Griselda, we are happy to have you here today as well, and excited to hear a little more about you and your work with B1.
Absolutely, thank you. Thank you for having me. When I think about the work that we're doing with B1, something that comes to mind is, again, the privilege you spoke of being able to do this work at Otsuka, to work for an organization that has a deep commitment to the value of every mind. I personally grew up in a very civic-minded household. We understood from a very early age the impact that policy has on our lives at every level of government every day. Today, my role at Otsuka is really about an opportunity to continue to do the work of educating and informing, both internally and externally, around the issues of mental health and the impact that mental health inequities have with the disproportionately affecting minoritized and underrepresented communities. Certain health policies really can have that deleterious impact. I think I'm most excited by the fact that we use data to inform and help us make important decisions around these topics. So, yeah, that meaningful component is something that continues to resonate through the work that we do, and I'm privileged to continue to do it. With regard to B1, one of the opportunities that I've had with B1 is to continue that education and information both internally and externally. We understood from the very beginning of the inception of B1 that part of our role is really to bring the important topics that Otsuka focuses on, not only to our Otsuka colleagues, but externally make our impact through our own networks. And one of the ways in which B1 has been able to do that has been through some of the work that we're doing, particularly Black History Month and this month in Mental Health, Minority Mental Health Awareness Month. And one of the opportunities that we had was to invite Daniel Dawes to speak to our organization to help us better understand the historical context associated with mental health inequities. And through that invitation, we were able to have Daniel come and speak when he was at the Satcher Health Leadership Institute at the time. And that meeting led to this very opportune relationship that exists with Otsuka now. And we are excited as an employee resource group to actually be a part of that, to have been a part of the fruition of that really exciting partnership and collaboration.
I couldn't agree more. It's incredibly inspiring to see what the collaboration between organizations like Otsuka and Meharry can bring forward in terms of solutions for our mental health care system. We do have a very complex mental health care system, and many people, whether or not they're living with a mental illness, feel that we are facing an ongoing mental health crisis. The statistics bear that out. If you look at Mental Health America issues an annual report, the state of mental health in America, and these are statistics that I know most of the people in the room already know, but it's worth repeating over and over again. Over 20% of Americans are living with a mental illness. That's 1 in 5 adults, and that comes out to be over 50 million individuals in America living with a mental illness. Now, furthermore, over half of that population of individuals has not received treatment for their mental illness. So that's over 28 million people not receiving treatment. And I think it's important to think about and ask the question: how many other conditions can you imagine 28 million people not receiving treatment for, let's say, a broken limb or cardiovascular disease? Congresswoman McClain mentioned something similar earlier. But there is hope. We are seeing changes. We're seeing more integration of the needs of health equity in conversations. We're seeing that with state and federal lawmakers and federal agencies. We are happy to see changes that CMS has made, small steps forward. But we really feel that there's so much more that needs to be done. And considering how deeply rooted the systemic inequities are in our healthcare system.
And Caroline, that's, again, more staggering data, but it is exciting to learn that there are some policy work that's being done, some momentum in that area. There's also some data showing that among those who live with mental illness, particularly non-Hispanic whites, adults are 52% more likely to receive treatment. There's also some additional data that 25% of Asian Americans compared to whites are likely to receive treatment. And that number increases slightly with Hispanic and Latino populations and Black and African American populations. But still, it's not at parity. Which I think is really interesting. And it's so important to develop solutions for minority populations who are living with mental illness. And we understand that there are already significant barriers to appropriate treatment and resources. I want to share some additional data if I could. For example, as you said, nearly half of the US population 47% lives in a mental health workforce shortage area, making lack of access one of the most significant barriers to treatment. And for every 350 individuals, there is only one mental health provider. In rural areas, also particularly difficult to access a mental health provider. And then, of course, there's things like stigma, and stigma about a particular illness, which may prevent those from actually seeking the help that they need. But we also want to appreciate the progress that's being made, particularly around CMS, and others that are exploring additional ways to include more community-based services, like peer support into their integrated care models. It's a critical tool to help bridge that workforce gap and address related issues, and really to support individuals with lived experience and their care team to ensure that they have access to those additional resources. So despite those aforementioned barriers that we talked about, we know there's important work happening, and we're excited to be a part of it to help address the inequities in mental health that disproportionately impact minoritized populations. Do you want to share some additional examples, Caroline?
Yes, thank you, Griselda. I did want to highlight a couple of excellent examples that some of our partners are doing to tackle pervasive inequities. One I wanted to mention is NAMI's Community Health Equity Alliance. It's an initiative that prioritizes community-informed solutions that address serious mental illness care at the state and local levels in select geographies. So the Alliance is bringing together thought leaders in the areas of mental health advocacy, faith, civic, and healthcare professional services, and the aim is to improve trusted delivery and pursuit of equitable mental health care for Black and African ancestry adults in the United States. The second one I wanted to mention is Mental Health America's Equity Impact Zone project, which addresses inequities specific to different communities, again at the local level, and they are running a pilot program with a community in New Jersey that will directly support those with lived experience to address social drivers of health inequities that are specific to that community, and that will expand into 5 other communities in the coming years. And then lastly, I wanted to highlight what the Depression and Bipolar Support Alliance's work on addressing mental health inequities through their Black support groups. And they've got great statistics that came out of their 2023 data showing participants in these groups reported a 45% increase in their sense of community and belonging. 60% of the members felt a reduction in stigma associated with seeking mental health support, and 70% of participants stated that they received valuable information and referrals they otherwise would not have had. I think this data is really compelling, and it underscores the importance of the initiatives that promote equity by providing the essential emotional support, reducing stigma, and bridging gaps in care for Black communities.
I'm so excited to hear about those programs. It's really important to understand that there's real intentionality behind a lot of these community-based and national programs, and that's exciting to see the progress that's being made. As we have listened to the data and we're absorbing what this means and the impact of the work that's already happening and the work that sort of needs to continue to happen, one of the things I think about is I'm still emboldened to continue what I do. I feel even more emboldened because when I'm data informed, I feel like I can take action on things. And I'm emboldened to continue not only to do my work as a health educator, to continue to provide access to information and knowledge and the data, because knowledge and data are power, and they're actionable things that we can do. I'm also excited to continue the work with B1 to continue to bring these opportunities and these topics to both Otsuka people as well as externally, and to collaborate and continue to partner with great partners like Daniel and other organizations. And really thrilled to be with you having this conversation today and to continue the conversation and to see so many folks who are very engaged and interested in this topic.
Thank you, Griselda. And I'll just wrap up very quickly and say that the burden of mental health inequities falls upon the shoulders of all of us. We feel that it's important to bring these dialogues and conversations to the forefront to continue to find solutions. We're happy and excited to be able to do that. And we have an incredible opportunity to collaborate to create a more equitable, person-centered healthcare system. Lastly, I just want to say thank you all so much for being here today. Thank you.